I'd like to welcome you to this edition of the PRS Journal Club podcast with your hosts, Dr. Sammy, Sinno, Amanda Silva, and Raj Sawh-Martinez. Enjoy.
Hi, everyone, and welcome to the 2016 May edition of PRS Journal Club podcast. I'm Sammy, Sinno, and I'm honored to be joined by my good friends and co-resident ambassadors Raj Sawh-Martinez and Amanda Silva. Today, our special guest moderator is Dr. Heather Furnas, who is an adjunct assistant professor at Stanford University's plastic surgery program. Dr. Furnas, thanks for joining us.
Thank you, Sammy. It's an honor and a pleasure to join the PRS Journal Club podcast.
Oh, we're excited to have you here. So the article we're going to review in this segment is 3D topographical surface changes in response to compartmental volumization of the medial cheek, defining a malar zone of augmentation. This is by Dr. Stern, Schreiber, Surik, Garfein, Jelks, and senior author Dr. Oren Tepper, who really is becoming a pioneer in 3D imaging studies. Interestingly, this study will be the subject of an online Twitter journal club. So I personally have a lot of questions that I'd like to ask the authors about this very interesting and well-done study. What they wanted to look at was the changes in terms of volume using 3D imaging technology when augmenting the deep malar compartment with analog fat. What they did here was looking with cadavers. They injected applesauce, which is biomechanically very similar to injecting fat, in intervals up to 4 cc's in cadavers, looking at specifically the deep malar fat compartment. And this is a compartment that was first described by Dr. Pessa and Rorik in 2007 and is really considered to be the key compartment in terms of augmenting the deflated midface. And what they then did was take a variety of measurements in perimeter and diameter along the different volumes injected, again, analyzing these with 3D imaging. On the additional cadavers, they went similar volumization, but then also released the arcus marginalis and took some, again, images and noted that, interestingly, in addition to seeing obvious and well-defined augmentation of that compartment and its effect on the rejuvenation of the midface in these specimens, when they actually released the arcus, they noticed that the cephalic border was then free, and they also had blending of that lid-cheek junction in that area. And they showed this in very nice images from their analysis in the manuscript. So by doing this, they define what they call a zone of augmentation that can then be applied to other regions of injection and augmentation and further explored in other areas with similar techniques. So I think for me, this is a very exciting study because it really lays out two very interesting avenues in the future of aesthetic surgery. Number one, I think everyone now is appreciating both non-surgically and surgically the importance of augmenting the deflated midface, and that what surgical techniques can do in terms of repositioning deflated soft tissues is not always enough. And in patients that have a certain degree of volume deflation, you need to augment the deep malar compartment that abuts the soup that's been, as I said, described in the literature. And then two, the role of 3D imaging in the future of aesthetic facial plastic surgery. We've already seen what a lot of technology can do in breast surgery and in terms of studying the volumization of the breast, but particularly as these pioneering authors are starting to look at in the face, I think the future of facial aesthetic surgery and potentially non-invasive techniques, non-surgical techniques rather, is potentially going to be defined by the ability of plastic surgeons to understand and utilize 3D imaging in their practice. So Dr. Furnas, what do you think about this paper, and what do you think about some of these issues going forward?
Oh, I love this paper. It was just sort of an exciting next step in understanding the fat compartment, specifically, as you mentioned, the deep medial cheek compartment. And starting in 2002, when Val Lambros published his PRS article, Periorbital and Midface Aging, he said, if descent is not the dominant factor in changing upper midface curves, then what is it? And that was sort of the beginning of really looking at those fat compartments, which have been exquisitely defined by Rourke, Pessa, and Risto, and then Wan et al. And other authors have shown that the deep medial cheek fat atrophies with age in a very different way than the superficial fat, and that the adipose cells themselves are different. They're smaller than the superficial fat. So it's really an independent entity, and so injecting specifically that compartment, not around it, is important and does a remarkable job in rejuvenating the face. I think that, first of all, I also love the fact that they used applesauce. I don't know if I'll ever look at applesauce in the same way again. but they, so that, right, yeah. That represents.
Try it at home.
Yeah. That represents fat, and then they could do a study, of course, looking at the difference between fat and its viscosity and change with hyaluronic acid. And also, in the future, you're injecting fat, which comes from the human body, which ages just like the fat compartment fat itself does. So, what is the longevity? What would be the 3D topographic changes that would occur in the fat that's been injected with time? So it's just a springboard for a lot of other exciting information down the road.
Right.
Dr. Furnas, when you do midface rejuvenation in this way, when you refill the midface, do you have a preference on using filler versus fat, or can you kind of talk a little about technique? Or?
We're using filler for the most part now, and we're just getting into fat, and we've been looking at the best techniques and whatnot. But an article like this is really interesting, just because it sort of helps with the definition of the proper anatomy and ultimately the correct injection, because that is something I wonder about. What is over-injection, under-injection? They found that between 2 and 3 mLs was the ideal volume. Beyond that, you're getting more projection, but you're not really expanding the perimeter a lot. So that is not reversible, whereas, it can atrophy or absorb, but, to a certain degree, but, whereas hyaluronic acid is. So there are advantages to each.
Yeah, one of the things, I've been sort of fortunate, Dr. Furnas, just a full disclosure here. I visited your practice out there recently, and I remember you showing me some pre and post-op pictures and some of the things that the estheticians in your practice were also doing, and really the amount of mid-face lift that can really be got by filler. For sort of the younger patients in the 40s and 50s who may not be candidates yet for facelifts, it seems like using filler and maybe fat, and like you're mentioning some of the complexities with actually using fat for the same effect, sort of do away and really do impressively restore sort of that youthful look. And that I was blown away by just the inflation, the 3D inflation completely does away with, bags under the eyes, and really creates a nice aesthetic appearance that they really describe well in the study of exactly where those areas are that you would need to inject. Do you think it's translatable, these augmentation fat zones, to
I do. And, if I look at Dr. Rourke's paper, 2006 or 7, he states saline injection of this compartment was noted to improve mid-face projection and to efface the nasolabial fold. Clinically, that was in cadavers, but clinically this technique improves mid-face projection and recreates a youthful cheek. In addition, the V deformity of the lower lid is improved and the prominence of the nasolabial fold is diminished. So it's amazing the benefit that you can get. Now that we have Voluma, we're seeing improvement in the jowl, in early jowls by actually augmenting in the malar area. So those little aliquots make a difference.
Right. And one of the things I've seen some people, just a quick, sorry, I mean, just a quick question is, does this then make you change the order in which you inject certain areas, right? It seems like you would want to inject the mid-face first and then see what changes you've gotten by those deep injections and then go around the face. Just because if you do the opposite, your effect on the mid-face could really impact what you do in the jowls, like you're saying. Is that a good way to think about it?
Yeah, it's a great way to think about it, and then there's always the individualizing the treatment. Somebody with a small chin is going to have, early jowling over, somebody else who has a large chin. So there are differences that you see earlier in parts of the face, just depending on the skeletal anatomy, the BMI, type of skin. Lots of things impact that. But yes, this is a sort of the anchor, I think, of anti-aging.
Well, as you said, obviously there's patient specifically, it'd be different injecting fat that changes with time, as well as in living tissue. They point out these limitations, but I think what's really interesting and exciting about this study is they will set the table for so many future studies and potentially have an algorithm that at least conceptually we can start to better understand how to approach the augmentation of filling the deflated face, rather than sort of, I always get a kick out of going to the meetings and you hear some surgeons talk about fat compartments and then you hear others say, well, I just kind of put it where it needs to go. But I think what the surgeons that you've talked about already, Dr. Furnas, Dr. Lambros, and Pessa and Rourke, have shown us that fat compartments are real. The anatomy has shown us that they're individual compartments with their own perforator and they're septated, and that the deep malar compartment is really important. And I think we not only need to understand and appreciate the anatomy, but now develop a strategy and understanding the effects of what you do when you augment one compartment, its relationship to surrounding anatomic regions, and maybe what's the best outline and plan of attack for doing all of this. What do you think about that?
Yeah, I agree. I think that just the work that's been done is exciting. We started out with facelifts, and Stuzen and Rourke were sort of looking at the flattening effect that a facelift can give, and looking at the benefit of filling, so that you combine a facelift with filling to really create a more rejuvenated look. So what would be your 20-second takeaway, Sammy?
My 20-second takeaway is that there is a profound effect on the volumization of the midface when you augment the deep malar compartment. That's not unlimited. Obviously, at a certain point you have diminishing returns, but in the 2 to 3 centimeter range, cc range, you can get a profound impact of volumization of the midface with injection into this compartment, and that there's many exciting future studies on the horizon.
How about you, Raj?
Sure. So I think this study, to me, builds on some of the key groundbreaking landmark work that has defined the midface and injecting that volume there as having profound effects on any kind of facial rejuvenation attempts, whether it be filler, facelifts, or fat grafting. And to me, the study, I really think the big thing that everyone should not miss, go to PRSjournal.com and click on the study and look at figures really 6 and table 1. Figure 6 is really showing when you cut that arcus marginalis release, really demonstrating the descent of what exactly happens and where the tissues go. And then table 1, you're being able to predict now CC to CC, based on this study, what the different movements in the perimeter, diameter, and the exact projection that you may expect depending on how much you inject. And certainly, like you guys, Sammy and Dr. Furnas and Amanda are saying, longer-term studies do need to look at what the long-term effects of this is. But in the immediate phase, we would know exactly what effect you would get. And this is completely novel and has not really been shown in this level of specificity thanks to the 3D imaging they've done here.
And Raj, and you stopwatch because obviously. I
think Raj used my 20 seconds.
Yeah.
Okay, Amanda.
I mean,
take it away.
Exactly what those two guys said. Like, this is a great paper for something that at least I've started to hear the aesthetic surgeons talk about when I've done rotations about filling the midface to lift the midface rather than filling your nasal labial folds to try to get that lift. And it's just a nice study that looks at the key details, the key anatomy, and talks about the amount, the anatomy, and the ligaments to consider releasing to get a better fill and a more natural-looking fill. So I think it's a great study, and anyone who is starting off or even far along on aesthetic facial surgery, I think it's a great one to read.
Great.
Well, thanks, Dr. Furnas, so much for joining us in this great discussion on this very exciting paper. And please, everyone, don't forget to join us on Twitter for the live discussion. Feel free to ask these authors anything. I know they're excited about discussing this with all of you. And again, Dr. Furnas, thanks so much for joining us. This was a great podcast.
Oh, thanks to all of you.